Good day and welcome to this webinar on Socieux Plus. This is an info session by Belgian actors on the EU expertise on social protection, labour and employment. This webinar is hosted by Ecos Health, the Belgian platform on international health, and my name is Tim Rosen, your host of today. Today we will try to cover a number of objectives through this info session. We will hear from two main guests who will introduce Socieux EU expertise on social protection and its expansion into Socieux Plus. There will be a presentation by Belgian partners, the Federal Public Service on Social Protection and the Belgian Technical Corporation and their role within Socieux Plus. And we hope from the participants to hear more from their experiences and be able to ask questions to the presenters. This is a recorded session and there will be a Q&A at the end of the session. So without further ado, allow me to present the two key speakers of today. Mr. Koen Vlemmings, Director, Research and International Cooperation at the Federal Public Service of Social Security and the Belgian International Corporation on Social Protection, named Belgian and Mr. Stefan van Bastelare, a Senior Health Expert at the Belgian Technical Corporation Agency, BTC-CTB. So without further ado, the floor is to Mr. Koen Vlemmings. This is a recorded webinar. Please note that we experienced some sound challenges for the first couple of slides. You will hear and see Mr. Koen Vlemmings just after the following slides.
The flow of information systems we provide in systems. We provide best practices and comparative studies from the 28 partner countries. We provide feasibility studies, and we are ready to adapt ourselves to all kinds of needs that can be expressed by our potential partner countries. Next slide. So how does Socieux function? So we have a process, first of all, which starts, as we are demand-driven, by a submission of a request by one of the Socieux partner or institution. That can be an administration, that can be also other institutes working on behalf of a public agency. It could be also NGOs, for instance, the social partners. So it's quite broad also the kind of institutions that can submit requests. And so secondly, when we receive the request, we try to clarify the expected results, the deliverables. We can assist the person submitting the request in clarifying his application, and then we start formulating a work plan together with this partner. So for the potential support by Socieux and its network of technical experts. Just one click, yeah. Then we prepare the implementation of the project or the support, which identify relevant European institutions which could provide support to the applicant. So we use our partnership member networks and we are focusing primarily on public experts, but we have also a database including private experts, so we can provide all kinds of expertise that fits the application that we have received. So what we also do is, of course, we monitor and evaluate each time we provide assistance. That is a participatory process. So we try to discuss the implementation and the productive results of the project, and we try also to disseminate the outcomes. So in one of the new aspects of Socieux is that we also work on knowledge development. So we have a meta process going on that tries to learn from previous experiences of providing assistance. And so in that end, that we will have a broader knowledge and will accumulate our experience with regard to providing assistance in the development of social protection and labor market policies. So what do we do? So in the end, this is what we have done in the recent years. So we have provided assistance to 33 countries, mostly in Africa. So about 45% of our applications came from African countries. But we have also provided assistance to countries in Central Asia and in South America. And in 2016, we have seen an increase in applications from Asian countries. So there is a strong interest from Asian countries at this moment, from Vietnam, etc., for this kind of assistance that Socieux can provide. So, yeah, just to give you an overview, we have over 1,730 expert days and 71 activities missions by the end of 2016. So that was the previous social program focusing only on social protection, not on labor market policies. And so we see that the expertise that has been provided has been coming mainly from France, but also from Spain, United Kingdom, Germany, and then Belgium. And so we have, of course, also from other European countries mobilized expertise from the Netherlands, Lithuania, Croatia, etc. So it's really diverse. We can pull expertise from these 28 member countries. And so we have provided a lot of assistance in that period to the Dominican Republic, to Lebanon, to London, but also to South Africa, Morocco, etc. So Vietnam and other countries. Well, also we can also provide support in developing social health protection, which is one of the ILO's priorities, providing accessible, essential healthcare. And of course, Socieux can also provide assistance in countries and institutions interested in developing their health protection. And we can go, in providing our support, we can of course go much broader than the social health protection initiative. So we are interested in also broader service coverage and population coverage and financial risk protection. So we can also provide support on a broader basis for this universal health coverage development. So, well, we can provide expertise from public and civil society experts from, that's a typo, 28 European Union member states, but with some of the oldest, but also most recent and comprehensive social health protection schemes in the world, covering about 580 million people. So we can provide support on stewardship, policy and strategy design, situational analysis, system design, economic analysis, cost-benefit, benefit incidents, also on social dialogue and representative governance structures. We can provide assistance on improving coverage, development of population coverage. We can also assist in implementing expansion strategies, the coverage of independent workers, contribution calculation. We can provide expertise on pooling, management of funding and risk pools, equalization mechanisms, and also needs and assessment on benefit package design, complementary package definition. So in the end, even in this field of universal health coverage, Socieux has a really broad network of experts provided by these 28 European Union member states, which is of course gives a really rich potential for potential partners worldwide that need support in developing those policies. And so, of course, an important element is, of course, that this is financed foremost by the European Union. So, and it's tailored on the needs of the countries that request the support. So I think Socieux has quite a lot of advantages for potential partners. So now I will explain how to apply for Socieux. So how you can prepare a partner. So first of all, who can submit requests to Socieux? Public administrations and mandated institutions in charge of social protection and employment are mandated. So both on the national, regional, and local level, as well as involved NGOs such as the social partners. How you can submit a request for Socieux assistance? That's quite easy. We have a website where you can download an application form. You see the web address here. It's quite simple: www.socieux.eu. You can also, of course, provide supporting documents and other information together with your application, and then you can simply submit it by email. And it's quite an easy process. And even if your application is not really developed, we can provide assistance to improve the focus of your application. So we are really a partner with you already in the application process. So the Socieux team will assist you in clarifying your application. If needed, we can have a fact-finding mission in order to provide further assistance for those that are interested in Socieux support. And so, if you have any question, you can contact the Socieux team. So it is an email address, contact@socieux.eu. And of course, we have additional information, leaflets and information on our website. So thank you. So this is the contact information. The Socieux headquarters is at the Federal Public Social Security in Belgium, in Brussels. So you see the address, it's based in the Finance Tower in Brussels. You see the email address and the phone number and the web address. So I invite you to consult the website and to consider an application for Socieux support if you really need tailored advice on topics related to the development of social protection and labor market policies.
Thank you, Koen, for this elaborate presentation, and great to end with a very practical guidance on how to apply. So we're going to move to our next speaker of the Belgian Technical Cooperation. But I can see there's people attending, so there will be space just afterwards for Q&A, so just be prepared to state your name, organization, and ask your question. I had one small, before we move on, Koen, if you allow me, very small question of clarification. Could you say in 2 words what is BTC-CTB, who you work for?
Well, Belinkosoc is in fact Socieux on a Belgian level, in the sense that Belinkosoc was founded in 2013 with the objective to mobilize the Belgians' expertise on social protection for international cooperation. And so we are a shared service center operating for the 16 social security institutions, but we have also expanded to, we have partnerships with the Federal Public Service Employment and with the Parliamentary Service for Social Integration. And so we are a facilitator and a mobilizer. So we try to bring interested partner countries in contact with the expertise of the Belgian Social Security Network. And so we mostly are financed by European Union grants, but we have also a framework agreement with Belgian Technical Cooperation, and so that is the next speaker. And together we are also partner in Socieux Plus. So we are intending to increase our cooperation in this domain of social protection.
Okay, thank you very much. Good. So without further ado, we're going to move on and come to our next speaker, who is Stefan van Baslaren, who's Senior Health Expert at BTC. So Stefan, the floor is yours.
So good morning, everybody. Just a few additional words, because I think the presentation of Koen has been very complete. I'll maybe limit myself to explain how we see the partnership between Belinkosoc and Belgian development agencies. And then secondly, I'll focus on the domains and on the countries where we propose to be more actively involved in. So let me come to the first point. Indeed, as Koen explained, Belinkosoc is now an institutional partner of BTC, Belgian Development Agency. We were created in '99 after a reform of Belgian technical cooperation. BTC works in today 20 partner countries, but it will be scaled down to 14 partner countries, and we're active in almost all development sectors as recognized by OCDE. Belinkosoc being very specialized in social protection, in 2016 we saw there was an opportunity for collaboration as we as BTC developed ourselves during the last 15 years, maybe in other domains where the focus for Belinkosoc was less important. So that brings me to my second point. In fact, why did we choose for that partnership with Belinkosoc? Well, we felt that, like for example, in basic social services, Belgian Development Agency has things to offer. When it comes to organizing universal health insurance, BTC, Belgian Development Agency, has certain things to offer. We are an institutional partner, for example, in Peru, of the SIS, the Sistema Integral de Salud, Seguro Integral de Salud. We are working in some West African countries on universal health insurance and so on. And then after these two first domains, a very important one that was added recently, I think it was on the one hand added to Socieux Plus, but it was added to the package of activities of BTC, and that's the full set on employment and labor. And as you all know, we have today a Minister of International Development Cooperation, Alexander De Croo, and his two main focuses of all his activities are human rights and local inclusive, economical, sustainable growth. And so more and more BTC is developing projects in the new partner countries, for example, like Burkina Faso, Guinea, we are working on the development of programs exclusively on local, inclusive, sustainable growth, with entrepreneuriat, making local entrepreneurs, with vocational trainings, working on conditions for decent work, and so on and so on. And then on top of that, and as already mentioned by Koen, we are having different framework agreements, and we think it might be a good thing to mobilize through these framework agreements, like for example with ONEM, with Sintra, with Belingosoc, with Copami, mobilizing further expertise. So I think that's maybe in a nutshell the reason why BTC is glad to be on board. With Belingosoc, we are very complementary partners, and I'm sure that Belgium is having a lot of expertise in the social protection on the one hand and development of sound employment and labor policies and so on and so on. So that was maybe my two most important contributions. No further slides for me. And just concluding that, yes, I am very happy to be a partner of Socieux Plus. It's a flexible vehicle for bringing expertise, public expertise to public socially oriented institutions in 145 partner countries, and that's a big challenge. So thank you, and micro back to Tim.
Thank you, Stefan, for that very brief and very good explanation of the role of BTC. This is a webinar information session, so it's very helpful to get that position clear and to get clarifications on the role and the value added on the partnerships. So this is the part of presentations. So we're going to now move to the second part where participants can ask questions of clarifications, and we'll touch upon a few issues before wrapping up this webinar. So I'd like to invite any participants to unmute themselves when they are ready to speak, and just state your name and organization, and then the floor is yours. We can hear you. I'm afraid there's a technical issue there. So while we try to solve that, allow me to ask a question myself. Perhaps first a very practical question of clarification to Koen or to both of you. You mentioned that Belingosoc is very agile, flexible, and swift tool, mechanism. You mentioned there's a response that can be given within 45 days, if I understood well. Correct me if I misunderstood. Could you also give an idea of how long, on average, the missions take place? What is the length and duration of sessions?
Well, it's Socieux mostly, of course, that focuses on the short-term assistance, and also to have a swift response to demands by partner countries. So within 45 days, we have a target of 45 days between the application and the start of the action. So that's really short. So the missions, well, they can be 10 to 20 days missions. They can be shorter. They can a little bit be longer. I think the average was about 20 days. I think 20 days. In the past for the Socieux program. As far as Belingosoc is concerned, maybe I should add this: we are We are a partner in European-funded twinning projects. We have a pin twinning project with Morocco, for instance, and we have a longer cooperation project for 5 years together with some partner countries, providing assistance to the People's Republic of China in developing their social protection and labor market programs. We were heavily involved in providing support for redeveloping their pension system. And there, of course, given the fact that it's a project of 4 or 5 years, we have also longer missions up to a month providing assistance. We have also, together with our partners, an office in Beijing that really provides structural support for the entire period of the project. So the Linkasoc has, within these European projects, longer projects of cooperation. Twinning project is for 2-3 years even. Where Socieux is more on the short term, really specific actions that are tailor-made on the needs of the applicants. And so the focus is more on the more short-term assistance.
So maybe to add on that, I think for the audience, it's indeed important to distinguish Socieux Plus, funded by EU and co-funded by three other members of the consortium, and then the twinning programs that's funded by EU as well, but with a slightly different scope. And another maybe additional information is on the number of days of consultants that can be sent during this Socieux Plus. As Koen already showed, I think in the Socieux there was like 1,632 expert days mobilized. With Socieux Plus, it's I think almost 10,000 expert days that will be mobilized. So that's an important thing. I think there's a lot of opportunities, there's a lot of money, but the system is simply different. With the twinning, you go directly, you present your project to the EU. With Socieux Plus, it's slightly different, and there you go into another channel for approval and for validation and for implementation. But the two systems do coexist, and according to your needs, it's maybe important to analyze a bit what are the specificities of twinning and what is the specificity of Socieux Plus. Thank you.
Thank you, Stefan, for that contribution. We're trying to go back to Elizabeth Paul, who is also online. Elizabeth, can you hear us and can you take the floor?
Yes. Hi. Can you hear me?
Yes, fine. The floor is yours.
Yes, I put my micro on mute just not to disturb you, but now it's open.
Yes, it is. The floor is yours.
Oh, but no, thank you very much to the presenters. It was very interesting. But I don't really have a question because I'm not a recipient country. But it's good to know that you have this possibility if the countries I work in would like to get support from Socieux. It was very interesting for me. But I don't have any specific question.
Elizabeth, what is your background?
Hello. But I used to work for BTC. But I work in the health sector, and currently at the University of Liège, I'm a researcher in a research project on universal health coverage in Benin and Senegal. And Steph mentioned the Socieux facility last week because we had some partners from Senegal, and they could be interested in requesting your support.
Thank you, Elizabeth. Question, please do not hesitate to still come in. I have a follow-up question, if you allow me, to Stefan or Koen. So you mentioned the extension of Socieux to Socieux Plus has been made by expanding from social protection more to labor and employment, and the emphasis on inclusive growth from the Belgian side. So could you say a few words how this links to health specifically? Because health is the platform of Belgian actors working on health. We're specifically interested how this affects or how this may be an opportunity for health. The floor is yours.
Well, given the fact that Socieux Plus provides such a broad assistance in a very broad field that also covers health policies. So I already mentioned in one of the slides all the kinds of different forms of expertise that can be provided through Socieux Plus to countries or NGOs applying for support for developing specific health policies within this program of the universal health coverage. So I don't know, maybe Steph can also add something more about this.
Yes.
Health expert.
Sure. Thank you very much, Tim, for this excellent question. I think it cannot be enough emphasized or highlighted how important it is if you want to work on local inclusive economical growth, that you consider all dimensions and all determinants of an inclusive, sustainable growth. And that's, I think, one of the reasons why Socieux is so important, because we put the emphasis on social protection, we put the emphasis on good health, we put the emphasis on decent work, and not only on jobs. It's important to create jobs and to train people, but it's as important to work on social protection policies, to work on concrete operational systems, and so on. And I think there's a big role to play by Socieux Plus, by doing a lobbying, by doing some advocacy on the importance of all these determinants for local inclusive sustainable growth. And today, I think there is nothing concrete. We are waiting for the proposals and for the requests of the partners. But for me, I see a big opportunity to really focus and put some emphasis on the importance of good health. Because without good health, you go nowhere with your entrepreneurs. Without risk policy, you will go nowhere with your local entrepreneurs. If you don't think at setting up a kind of system when somebody gets injured or somebody is facing a disaster. So I think it's very, very important to see Socieux as some kind of advocate for inclusive, comprehensive and broad economic, inclusive, sustainable development. Thank you.
Thank you both for those answers. A final question, except if someone else from the audience has still a question. To you, Koen, and perhaps again, Stefan, to add. Can you specifically highlight it in your slides that Socieux Plus is demand-driven, and if I understood well, this is very much demand-driven by member states who seek the technical expertise, but it can be broader, as you mentioned, from other social partners as well. I want to ask you how the offer of technical expertise that is on the side of providing services is making a link with more the demand side, creating a demand for social services, and I'm particularly thinking about health. As you know, the mouvement de mutualité and the health insurance mutuelle, who emphasize more mobilizing people to create specific demand and look at quality. So I was wondering if you could comment on how the expertise also links to that side. The floor is yours.
We certainly try to assist countries in developing their health policies, and so in that sense we are also operating within this framework of promoting the sustainable development goals, and particularly the social goals within this framework. We at this phase we are trying, really like I'm doing now, we are trying to promote Socieux as a possibility for countries to develop their social policies, their health policies, and so we offer them the expertise that is available in the 28 European Union member countries to assist them. And so in that sense we try to really provide an incentive also to develop these policies, and I think that Socieux is a really big opportunity for anybody in these 145 partner countries, be it administrations, health organizations, NGOs, and so on. So Socieux is really a good opportunity to take another step in the development of their policies. And so, given the fact that it's such the areas of work are now so broadly defined, that there are really a lot of opportunities.
Maybe to add a bit on that, I think as it was said before, the Socieux Plus it's a broad offer. We can work on the provision of social services, and that for me includes, like, for example, basic health services, and I can very well imagine that one day a partner country will come with a request for setting up a policy on basic health services, on defining packages for essential health, for packages on complementary health, and I think it's all open. It's all within the scope of Socieux Plus, giving policy support, strategy support, helping countries to make their systems function better. It's fully within the possibilities of Socieux Plus, and be it on the offer side or be it on the demand side, I think we all know very well that putting a support to the demand side makes no sense if you don't have good quality health services in your country, if you don't have good quality education services in your country. So as Socieux Plus is open to the broad field of giving social services to all the populations, I think it's very open to these kind of supports or assistance in expertise as well. Thank you.
Thank you both for that contribution, which I believe is a final question. I hereby would like to thank both of you, Koen and Stefan, for your presentation, for answering all the different questions. This is a recorded session and will be available at the website www.becausehealth.be, and anyone who's interested to learn more about it can contact the experts via Because Health or directly. And if you'd like to be involved in doing more as a working group, then also please do not hesitate to contact us at becausehealth@itz.be. So without further ado, thank you very much, and see you soon. Goodbye.
Thanks. Bye.
Bye-bye.